What is the new COVID-22 and what differentiates it from the original product? Symptoms, uncontrolled infections and a vaccine on the horizon. The seventh wave of the coronavirus pandemic is already established in Spain with two Omicron subvariants, BA.4 and BA.5, responsible for the rising curve of infections in recent weeks, as shown by the Ministry of Health data. However, these sublineages of the virus show a different behavior in infected and vaccinated people compared to the original Omicron variant, which is already leading experts to talk about a new disease, called COVID-22. This is what the Director General of the Madrid Health Service, SERMAS, Antonio Zapatero, said this week. It is a disease caused by a different virus, caused by different mutations from the original, which also makes it have a different clinical outcome. For Dr. Marcos López Hoyos, president of the Spanish Society of Immunology, today, SARS-CoV-2 produces a viral infection, as if it were a cold, and less aggressive, he said in an interview with Guías de Salud. These are the main points to remember about this old new disease that is making a comeback in Spain on the eve of the summer vacations. Why there are so many cases? The explosion of positive cases in recent weeks is confirmed by data provided by the Ministry of Health. Since the 10th of June, the cumulative incidence in the last 14 days in people over 60 years old has increased from 589 cases per 100,000 inhabitants to 996 last Friday, the last day for which official figures are available. This increase is explained, according to Health, by the greater capacity of BA.4 and BA.5 to partially escape the immune response generated by the vaccines and previous infection, hence the infections and reinfections in people vaccinated even with the 3 doses. The likelihood of these subvariants taking over the rest of the currently circulating lineages is considered very high, they explain in a recent report. In addition, they point out that BA.5 has the highest rate of expansion according to data from genomic surveillance. While these more supercontagious forms of the virus cause infections and, therefore, hospitalizations, this is not the case for the more severe cases or deaths. They are more transmissible, but less serious than in previous stages, stressed this week the Minister of Health Carolina Darius. Hospital pressure rose in 1 week from 6.3% to 8.3%, with 10,249 admissions, 2,456 more than last week, while in intensive care units the increase was 1 point, from 4 to 5.06%, a figure that health authorities continue to consider stabilization. The difference from the 6th wave, last winter, is evident when comparing the most serious cases. If at that time the intensive care units had more than 1,300 critical cases, this figure is now 449, so the severity of cases is even lower. The invisible wave. This 7th wave of coronavirus is nicknamed by many the invisible or silent wave, because the data reported by the Ministry of Health, although they reflect this recovery, do not give a true picture of the incidence in Spain. Since the end of March, the autonomous communities only include in their statistics the cumulative incidence in the over 60s, so infections in the rest of the population are not included in the COVID surveillance system and are not reflected in the ministry's updates. What are the symptoms? The symptom picture of BA.4 and BA.5 also differs from previous variants, including the original Omicron, the lineage from which they originated. In addition, the intense symptoms also seem to disappear earlier with these subvariants, as virologist Estanislao Nistel recently pointed out in statements to Telemadrid. The most important signs are still the same as with Omicron: asthenia or fatigue, cough, fever, headache or runny nose, but others are more likely than with the original Omicron variant: loss of smell, anosmia, loss of taste, ageusia, vomiting or diarrhea, according to South Africa's National Institute for Communicable Diseases. It also more commonly causes sore throat, muscle pain, shortness of breath, dyspnea, and dizziness. Although these symptoms may disappear earlier in infected people, it takes longer for the antigens to disappear, Nistel said, which is why it is possible to continue to test positive for a longer period of time. 4th dose of vaccine. The increase in cases has led some communities, such as Catalonia, to increase pressure on the Ministry of Health to reconsider the option of bringing forward to the summer the fourth booster dose of the COVID vaccine for people over 80 and other vulnerable groups. In this regard, the department headed by Carolina Darius did not specify whether or not it would advance the vaccination, and merely said that it would follow the advice of the experts of the Vaccine Committee, which meets periodically to make its proposals. People over 80 years old and those living in retirement homes should be vaccinated. We now need to determine when, Darius added last Friday. Are current vaccines still effective? Along with deadlines for the fourth dose to be administered to the general population, health officials are considering which vaccine to use now to boost immunity more effectively, as it has become clear that these new subviruses more easily escape the antibody-mediated immunity generated by previous doses. For weeks, experts have been warning that if this fourth dose is the same as the one given so far, it doesn't make sense to inoculate against these new variants, because these are monovalent vaccines designed for the original strain, Wuhan, and since then the virus has changed. That's why the focus is on bivariate or binary vaccines, which protect against two variants, that pharmaceutical companies such as Moderna and Pfizer are already working on with very positive results. As for when these vaccines adapted to the new variants will arrive in Spain, Darius once again put the ball back in the court of the Vaccine Committee, which will be the one to make this decision, and estimated that these doses to combat the new predominant variants will allow for a better disposition to face the virus,